Good afternoon, everybody.
Good afternoon.
Okay, so today in the press briefing, we are saying goodbye to two of our amazing interns. I think they're here somewhere. Ah, there they go. Kate Howell and Molly Feldman. They have been great additions to our team these past several months, and they are now going back to school, hopefully enjoying the holiday before you go back to school. But thank you so much for your hard work. And today we have a familiar face with us to talk about how the President's winter preparedness plan on COVID-19 increases as COVID-19 increases as the holiday, as we head into the holidays. And so Dr. Jha is here to talk about this plan and take some questions as well. Dr. Jha?
Great.
Thank you, KJP. Good afternoon, everyone. Good to be with all of you again. As expected, we're seeing COVID rising across the country this winter. And while COVID isn't the disruptive force it once was, we are focused on ensuring that the U.S. is prepared for this winter, no matter what the virus throws at us. As you know, we have the tools, we have the infrastructure, and we have the know-how to manage this moment. And that means protecting people, preventing hospitalizations and deaths. And the key is this: we don't want this winter to look like last winter or the winter before. And our winter COVID-19 preparedness plan helps us do just that. So how do we do that? First, and you're not going to be surprised to hear me say this, the most important thing Americans can do is to go get their updated COVID-19 vaccine right away. Now, you heard this from Dr. Fauci just before Thanksgiving. You heard this from me. And I will repeat again, the updated COVID-19 vaccine is your best protection against the version of COVID we're fighting right now. Second, a critical component of our winter plan is making it even easier for Americans to access the tools that will protect them this holiday season: vaccines, tests, and treatments. So let's talk about tests. Today, we're opening up covidtest.gov for a limited time this winter to give Americans another easy option to access testing when there's a greater need, as there is right now. Starting today, each U.S. household can order up to 4 at-home tests free from covidtest.gov, with tests starting to ship as early as next week, the week of December 19th. And as we've said for months, we're operating in a resource-constrained environment in the absence of additional congressional funding for the nation's COVID response. And that means we've had to make some tough choices. Like in the summer, we were forced to suspend the covidtest.gov program so we could preserve our tests. Why did we want to preserve our tests? Because we knew there would be a moment later in the year when COVID cases would rise again. So we preserved the tests so we could have them on hand for exactly this moment. And if we don't get more funding, we won't be able to send more tests out to the American people. Next, we're standing ready to support states and communities with medical personnel, supplies, and other resources, as the President has been committed to doing since the first day he took office. Today, Secretary Becerra is sending out a letter to all governors underscoring that our partnership with state and local leaders has been essential to fighting this virus. But the Secretary also made clear we need them to step up right now to get ahead of this increase in COVID that we are seeing across the country. And he outlined all of the federal supports available to set up more vaccination sites, more pop-up clinics to get more shots in arms, to expand test-to-treatment programs, including new test-to-treat programs, sites that the federal government can help with, to make key supplies like at-home tests widely available, and things that the federal government can do to support hospitals and health systems as needs arise. Because the bottom line is this: We're all in this together. Fourth, we are accelerating our efforts to protect the highest risk Americans, building on the considerable steps we have taken. Now, I want to remind everybody that more than 90% of COVID deaths in the US have occurred in people 50 years of age or older. And in recent months, we've seen COVID deaths really concentrated among those 65 and above. And while we've seen many older Americans step up and get the updated COVID vaccine, there's still too many older Americans who have not gotten their immunity updated, who have not gotten themselves protected. Under half of nursing home residents have gotten their updated COVID vaccine. So we are working very closely with leadership of nursing homes across America, and we have asked them to step up to do more. We've developed a winter playbook for nursing homes and long-term care facilities to help them take action, to make it easier to get vaccines on site in nursing homes, to make sure that treatments are available on site in nursing homes, to improve indoor air quality, another strategy that can make a really big difference. And we are reaching out to governors where nursing home vaccination rates are low to offer personalized support. Now, before taking your questions, let me close with this. We don't want this winter to look like last winter or the winter before. And it doesn't have to. What's different is that we have an updated vaccine that targets the version of the virus we're fighting. But we need people to get that vaccine. It's free and widely available. What's different this winter compared to last winter is we have highly effective treatments that are widely available if people get sick. But obviously we need doctors to prescribe them. We need people to get them. This winter, we can keep people safe. We can prevent hospitalizations and deaths. We can minimize disruptions. The administration has been planning for this moment. We are doing our part. We're prepared. But the bottom line is we need other leaders to step up as well. Governors, mayors, people who have been terrific partners throughout this entire pandemic. But here's what I know. If every American does their part, if every American goes out and gets an updated vaccine, if every American gets treated who's eligible for treatment, we can have a very different winter ahead. And that is the goal of this effort. So with that, let me stop, take questions, and KJP, I'll turn it back to you.
Thank you. Dr. Jha, moving out from the U.S. borders for just a second, certainly one of the risks that faces this nation is additional spread from a big outbreak in China. Can you give us a sense of whether the U.S. government was aware or made aware in advance that Paxlovid would be made available in China? And can you give us any sense of what talks are happening behind the scenes, to help get Western vaccines and medicines to that country?
Yeah, so on the specific question of Paxlovid, the U.S. government was not involved in any way, and it was, so really refer you to Pfizer, but we were not involved in that in any way, shape, or form. On the broader question you're raising, Jeff, what I would say is this, and since the beginning of this administration, the president has been very clear that we think it's really important for the world to benefit from the fruits of American scientific innovation. We have been the largest donor of vaccines in the world, almost 700 million doses, many bilateral, many through COVAX, and the president's been very clear. We stand ready to help any country that needs help in terms of vaccines, treatments, anything else. So that offer stands globally for any country that could benefit from it.
Would it be fair to characterize this as the U.S. and other Western countries are encouraging China to import mRNA vaccines, but not necessarily with U.S. or strong U.S. involvement? Does that give them cover that they need?
No, what I would say is we stand ready to help any country in the world with vaccines, treatments, anything else that we can be helpful with. We have been the biggest donor of vaccines, as I said, almost 700 million doses. And that stance of being helpful, being ready to help, continues and hasn't changed.
Thanks. Dr. Jha, looking at the most recent COVID numbers we have, it looks like COVID cases were up 45 or 50% week over week last week, but COVID deaths were up 60%. Why are COVID deaths spiking more dramatically than COVID cases are?
Yeah, it's a good question. So some of that is, by the way, data irregularity. Just to be clear, the data is we're in a different place with data. We get data less often. So in general, we have seen COVID cases go up. We've seen hospitalizations go up. Deaths are just starting to rise. I do think that standard link we've seen between cases and deaths are going to be different because there's less testing. So it's going to be later to see cases go up. But so far nationally in our analysis of the data, death numbers are just beginning to rise. We obviously want to make sure that does not go any further. We know we can prevent nearly every death from COVID if people get their updated vaccines and people get treated. So we continue to press that message.
And are you considering a return to other restrictions, masking on planes, vaccine requirements?
Yeah, so I think we're in a very different place with this virus and where we were 2 years ago, where we were last year. What I would say is we now have the tools that we can manage our lives much more safely than we could a couple of years ago. And the most important thing I think people need to be doing is, first of all, they've got to get their updated vaccines. And then there's a whole host of tools that people can use to keep themselves, their families safe. Testing, masking, improving indoor air quality, being in better ventilated places. And treatments, of course. So we think that is the strategy of the administration, that we want to encourage people to use those tools. And given how widespread and how available those tools are, I think if people did that, we could get through this winter safely.
Dr. Jha, just to follow up on Jeff's question, with China relaxing its zero COVID policies, what specific contingency plans do the administration have to deal with a potential outbreak or new variants, particularly with the increase of travel between the U.S. and China during the holidays and in the Lunar New Year? And do those considerations at this point include any talks of a travel ban?
Yeah, so we have a very robust surveillance program where we use for travelers as people come in terms of identifying people who are infected, tracking variants. That continues. And we generally are using wastewater, using other mechanisms, constantly monitoring for variants, both here as well as with our partners around the world, in Europe, in South Africa, in other places. I think all of that is a really important part of how we have become far more effective at being prepared for new variants. And if there are new variants that emerge, I'm confident that we will be able to identify them.
Thank you.
Dr. Jha, are we still facing a triple-demic where RSV, flu, and COVID are all surging at once over the holidays?
Yeah, so we have seen, certainly in the last month, 3 highly contagious respiratory viruses. As you mentioned, RSV, flu, and COVID. Let me tell you what we know about them. RSV nationally looks like it has clearly peaked and is on its way down. There's still places that have very high levels of RSV. But nationally, there's no question in my mind RSV is heading down. Flu is rising in many parts of the country. We're probably the worst flu outbreak we've seen in a decade. And there are some places where flu may be peaking, but it's very early data. But a lot of flu out there. Again, the worst in a decade. And then we talked about COVID, where clearly it's on an upswing with increasing number of cases.
One other question. Back in September, the president publicly said that the pandemic is over. How has that complicated the messaging to keep Americans vigilant facing COVID?
Yes, I think the president was also very clear that COVID is not over. COVID continues to pose a challenge for us. That is true. COVID is not over, and obviously we continue to see people getting infected, getting sick. Unfortunately, too many Americans needlessly dying of COVID. And so I think the president has been very clear on this, even since that day, about the importance of people getting vaccinated, people getting treated, and obviously I've been out here making that same message.
Two more. Go ahead, John.
Dr. Jha, thank you. Two questions for you. One, are there particular hot spots right now you're concerned about when it comes to COVID rise? And then secondly, based on all 3 of the viruses you've been discussing, could you talk to us about the strain on the nation's hospitals?
So particular hotspots, we're seeing cases increase in about 90% of the country. So it is really sort of rising in lots of places across the country. So there's not one that I think is particularly worse off. Obviously, the levels are different across the country, but it is rising pretty much uniformly, and it makes sense, right? We just had the Thanksgiving holidays. It's getting colder, even in the southern parts of the country. It's still getting colder. Obviously, we tend to see more in the northern half of the country because it is colder up here. People are spending more time indoors. In terms of hospital strain, this is something we monitor very, very closely. We look at a whole bunch of national data every day. We are talking to states and jurisdictions every day. Well, not every state and every jurisdiction every day, but on an ongoing basis. I would say in the last 10 days, I have probably spoken to, I or members of my team, a dozen or more states and cities, and our first question is, how are the hospitals doing? Do you need more help there? We have a very clear plan. If a city or a state gets into trouble where they really just can't manage, that they can reach out to the federal government. We have a whole set of resources. We can evaluate. We can send in equipment. We can send in personnel. So we stand ready to help cities and states if and or when they need it. Obviously, the single most important thing we can do to make sure that there aren't constraints and there aren't real problems with hospital capacity is if people got vaccinated, they are far less likely to get hospitalized for both flu and COVID. And that's the biggest thing Americans can do to make sure their hospitals are functional for all the other reasons we need hospitals.
Karen, last question.
Are you concerned that Americans who are testing positive but doing so on at-home rapid tests aren't reporting that to government agencies, so the case counts right now might be dramatically lower than what we're actually seeing for spread across the country?
Yeah, it's a really good question. What I would say is, first of all, I'm a huge fan of home tests. I think they're convenient, they're cheap, it's great. One of the problems of home tests, really the major problem, is that they don't often get reported. So we do have, through this NIH effort called MakeMyTestCount.gov, I think, that people can report their tests. But we have other mechanisms we use to monitor infection levels. So for instance, wastewater gives us very good insights into how much infection there is in a community. So we have seen case numbers often be lower than what you might expect if people were doing more PCR tests or more public health tests. But we're tracking infections through other mechanisms. And obviously we're tracking infections and hospitalizations, so that gives us a very good sense of the burden of disease as well. The last point I will make is when people test at home, if they test positive, the first thought every single American should have is, am I eligible for treatment? The truth is, we have fantastic treatments. Anybody over the age of 50, anybody with chronic disease should get evaluated. Personally, as a physician, I think it's very clear to me that anybody in their 60s or above should be treated. Like, there should be a good reason not to treat somebody. And they're rarely a good reason, meaning most people should be getting treated right now. That is a message we've been delivering to doctors and nurses. That's a message we've been delivering to the American people. If you get a positive test at home, stay away from others so you don't infect them, and get evaluated to get treated.
Ken, on the funding that is being used to purchase the new tests for this new round for people to get them sent to their houses, were there cuts to other COVID programs in order to pay for those tests?
Yeah, so let me talk about how we're able to do this. So we paused the program, at the end of the summer because we wanted to make sure that we still had supply for a winter potential increase of cases in the winter. Second is, while we, as I have mentioned from here before, while we took a lot of the resources we had for tests to purchase vaccines and treatments, we still had some resources left. We didn't deplete the whole supply, and so we had money in the American Rescue Plan to still be able to buy some more tests. That combination has allowed us to do this. It is on a limited basis. We're not going to be able to keep this open forever.
Okay, thank you, Doug.
AJP, thank you very much, and thanks everybody.
All right, happy holidays. Okay, just a couple of things at the top, and then we'll take some questions. So today's the final day of the U.S.-Africa Leaders Summit, a summit that has underscored the U.S. commitment to reinvigorating partnerships across the continent. President Biden, Vice President Harris, and other officials across the administration have had the opportunity to spend a lot of time with the leaders from across Africa over the last couple of days, including at last night's dinner here at the White House. Now, this afternoon, the President will address the summit one more time at this afternoon's discussion on food security and food system resilience. This week, President Biden and Vice President Harris have had the opportunity to announce new initiatives that will empower African institutions and citizens. The President reaffirmed our resolve to work collaboratively with African governments, businesses, and civil society to strengthen people-to-people ties, ensure more inclusive and responsive global institutions, build a strong and sustainable global economy, foster new technology and strengthen innovation, strengthen health systems, and prepare for the next pandemic, tackle the food security and climate crisis, support democracy and human rights, and advance peace and security. The Biden-Harris administration plans to commit at least $55 billion in Africa over the next 3 years, working closely with Congress, and more than $15 billion in private sector investment deals were announced at the U.S.-Africa Business Forum. And of course, you've heard the President announce this week's plan. this week to plan to travel to Africa and to continue the work over the course of this summit and to strengthen our partnership across the continent. I also want to talk about something that affects millions of people across the country every day. And with the holiday season upon us, and in the light of the tragic news about Twitch this week, we think it's important that we shed light on the resources available to any American dealing with mental health challenges or emotional distress. Tomorrow, said the second gentleman Douglas Emhoff, and leaders from Department of Health and Human Services will visit a local 988 call center and meet with crisis counselors who are providing mental health and suicide prevention support to people from all backgrounds and walks of life. The 988 Suicide and Prevention Lifeline provides free, confidential, 24/7 support to Americans across the country experiencing suicidal crisis or severe emotional distress. Anyone, anywhere in the country can call or text 988 or chat 988lifeline.org to reach a live trained counselor. And thanks to the President, our administration has invested $432 million in getting the 988 Suicide and Crisis Lifeline up and running in communities across the country, an 18-fold increase in investment from the previous administration. So before we go into questions, I'll repeat myself one last time here for all of you, all of those who are struggling. We stand with you, and our administration will keep fighting for you. One last thing before we really take questions is I want to give you guys a little bit of the week ahead. Just a quick look here. This evening, the President will travel to Wilmington, Delaware. Tomorrow, the President will visit and speak at a town hall at the Major Joseph R. Bo Biden III National Guard Reserve Center in Newcastle, Delaware. This is a capstone on the Department of Veterans Affairs PACT Act Week of Action with over 90 events and counting held across the country to encourage veterans to sign up for health care, get screened for toxic exposure, and submit a claim if they are experiencing a toxic exposure-related condition. The President will speak with veterans, their families, caregivers, and survivors to discuss the historic expansion of benefits and services resulting from the Bipartisan PACT Act. I anticipate a preview with more details will be shared ahead of the event, so please stay tuned to that. Afterwards, the President will return to Washington, D.C. for internal meetings and more holiday receptions. Friday evening, the President will return to Wilmington, Delaware, where he will remain over the weekend. On Monday, the President will return to Washington, D.C., and in the evening, he and the First Lady will host a Hanukkah holiday reception in the Grand Foyer, right here in the White House, in the residence, to be more precise. We'll have more to share on next week's guidance in the coming days, but we can also confirm today that next weekend, the President and First Lady will celebrate Christmas at the White House. And with that, Zeke, you want to kick us off?
Thanks, Karine. Just a bit of housekeeping to start off with. I was hoping you could shed some light on the apparent radio miscommunication that kept the White House press pool, separating the press pool from the President's motorcade when he returned to the White House today.
Yes. Give me 1 second because I do have something to share on that. So there was no emergency, just to be clear, or a security situation. And it appears that there was a radio miscommunication upon departure. Vans picked up the White House staff and press that were left at the convention center, so also White House staff were also left as well. And we waited to start the press briefing until everyone returned to the White House. We share an appreciation for how important it is for the press pool to travel with the President, and this remains a priority for our entire team. We sincerely apologize for the confusion and inconvenience, and just to reiterate, we also sadly left White House staff as well at the convention center. So it was not just the press. So just wanted to make that clear again. But with all seriousness, we do apologize for that.
The President, in his remarks earlier, alluded to a trip